So about a month ago, I got an urgent call from a new patient of mine. He was desperate because he was in excruciating pain. He was trying to pass a kidney stone that was not unlike this one, and it was 5 millimeters in diameter. This is sort of like trying to pass a very sharp apple seed, so not fun at all. And what I'm sure if any of you know anything about kidney stones, what you know is that they are very painful. You may not realize that kidney stones are becoming increasingly common. So every year, more adults and children are getting stones. So now more than 1 out of every 10 of you will get a kidney stone at some point in your lifetime. And when you do, you too may have severe pain. It might bring you to the emergency department. While you're there, you may urinate blood, which can be really scary for patients. You may get an infection, which can cause you to have antibiotics, and you may even have to have a urological procedure. So some of my patients in the course of their lifetime have had multiple urology procedures. In fact, that same patient, he's had so many, he's lost track. He doesn't even know how many he's had. Because they have to go back to the emergency department a lot, because my kidney stone patients have a lot of surgeries, kidney stones are incredibly expensive. So it's estimated that we spend billions every year in healthcare dollars treating kidney stones. My patients also have an increased risk of bone fracture, high blood pressure and heart disease, as well as chronic kidney disease and dialysis. However, this has started off very gloom and doom, but I promise you there is hope because kidney stones are preventable. We can stop kidney stones and we can prevent all the sequelae that I just described to you. So how do we do it? This is a urine jug, and every single one of my patients knows this well because they all complete 24-hour urine collections for me. In that, we measure all sorts of things. This gives me a sense of what I call their urine composition. That's because everyone who forms a kidney stone does so for a mix of things, partially their underlying hereditary genetic makeup, but also a number of environmental factors. So for example, the type of diet they have, what types of things that they eat, and how much they do. So for an individual patient, when I look at their urine composition, this helps me know why that person forms kidney stones, and even more importantly, what I can do to try to reduce that risk of forming a future stone. So for example, my patient, fortunately, he did pass that stone. I saw him just last week in clinic after he had completed his urine composition or urine collection. He has really low urine volume and really high urine calcium. And together we formulated a plan to improve both of those parameters. I'm going to see him again in clinic in just a few weeks. And after he's had a chance to work on those things, and we can see how well we did and what else we need to do to further make sure that he never forms a stone again, never has to go through that pain ever again. But also, from a research perspective, urine composition is really important to me. It helps me understand why some of my patients form kidney stones and other people never form kidney stones. So there's two other things we measure in the urine. One of them is called oxalate. This is present in the food. It's really abundant in our fruits and vegetables, for example. And when you eat it, it ends up in your urine. There's nothing inherently wrong with oxalate, but when it's in the urine, it can cause kidney stones. So to simplify it, I'm going to call it the bad stuff. There's also something called citrate. Citrate's also in our foods, abundant in fruits and vegetables, and when we eat it, it ends up in the urine. But fortunately, citrate actually inhibits or prevents kidney stones. So to simplify the explanation here, I'm going to call that the good stuff. So we found in a recent epidemiologic study, so I did this with over 13,000 patients in this study, and we found that these two things were associated with each other. So in my kidney stone patients, the higher the level of oxalate, that bad stuff, they raise their level of citrate, the good stuff. When I compare that to the non-kidney stone patients who had never formed one before, for that same rise in the bad stuff, they rose their good stuff, the citrate, 10-fold higher than the people who formed kidney stones. So based on this epidemiologic study, though, I don't know why that's the case. I don't know why these levels seem to rise together or why there was a difference between my kidney stone patients and people who have never formed a stone in terms of how well they were able to rise their level of that good stuff. So we're trying to figure that out. It could just be that this is all related to diet. We eat these things together, oxalate, citrate, the good and the bad stuff, we eat them together in our fruits and vegetables, and maybe that's why they both raise in our urine together. Alternatively, there could be something intrinsically different in the kidney and going on where once the kidney senses that bad stuff is higher in the urine and now there's a risk that urine's going to form a stone, maybe the kidney senses that and can increase the level of citrate, the good stuff, to try to prevent that future stone. So the first step of figuring this out is a research study that we're currently enrolling. We're going to remove the effective diet. We're going to give people, both kidney stone patients and non-kidney stone patients, a really small amount of that oxalate, that bad stuff. It's not in a dangerous level at all, but we're going to give it to them. What we're going to give is about the amount would be in a spinach salad, a small spinach salad. But we're going to give it to them without the same citrate that would have been in that same spinach salad. And we're going to measure their urine and try to see what happens with the levels. And between kidney stone patients and non-kidney stone patients, is there a difference? So, are you interested in our study? We would absolutely love to have you. Whether or not you form stones, we also have a number of other really interesting kidney stone studies in our group that we would love to have you participate in. So please contact me if you are. Do you form kidney stones? Is one of your loved ones, family members, friends, do they form kidney stones? We can prevent them, I promise, and it's worth it. Trust me, I ask my patients. And you can contact me. I'd be happy to see you in clinic myself or send you to one of my colleagues. And do you just want to learn more? Are you completely intrigued by the fact that people really do urinate something that looks just like that? It's true. You can learn more by looking at, this is one of our websites. This is run by one of my mentors and colleagues, Dr. Fred Coe. There's more about kidney stones than you could ever imagine on that website. So thank you. Thank you for the opportunity to tell you a little bit about what we're doing. I'm happy to talk to you more afterwards as well if you want to learn more about stones. Thank you.